The fibula, right? This is the tibia. The meridian starts from the fibular side, not on the tibial side. This tibial side is the spleen meridian, whereas in liver meridian starts on the lateral part of this is the medial side, this is the lateral side of the great toe. From the nail base it starts, it ascends upward direction. From here it goes to the ankle region, this called as a talocrural joint. From here it ascends upward direction. The meridian starts from the bone, not on the border. On the bone it ascends upward direction and then communicating to the medial side of the knee region. From the medial side of the knee it ascends upward direction. This is the topmost part of the tendon called as semimembranosus and semitendinosus tendon. Then it ascends upward direction and finally it goes to the gluteal region. From the inguinal region it ascends upward direction and then communicating to the lateral side of the abdominis muscles. From the abdominis muscles it reaches to the below the mammillary line, where the nipple is located below the nipple on the 6th intercostal space. The energy get terminated, right? In this pathway there are totally the 14 acupuncture points are located, but in fact all the 14 points are very imperative, and day-to-day clinical practice we can use it. But almost I say that all the meridians having 10 to 15 points are very good points. In that way this is around 10 points are really beautiful point we do require for the clinical practice. Now let me start from the one by one point. So this point to be known as a liver 1. Liver 1 point is, as I told you, tatun. Straightly you wipe the entire area. Is not that where you wanted to use, just wipe and then apply the needle. That is in fact is the wrong concept. Apply the entire region and then hold it this. And if what needle I need to select, see, I do have half chone, I do have 1 chone, I have 1.5 chone needles, right? So in this way this is the 13 mm, this is the 25 mm, this is 40 mm. Now which I need to use it, and what type of the muscles are existing, based on that we should select. But if we use 1 chone also can be selected, even 1.5 chone also be selected. But we are giving pain to the patient if we use the other needles. But now I wanted to use half chone needle, because the weight of the needle also matters here, because that hangs on the above the skin surface. That's the reason I just apply as a tonification. I holding this and just applying as a tonification. Take the deep breath. You just take the deep breath. I just inserted and done the slightly clockwise direction. I just turned this, indicating. That's the Professor Pajau's technique, indicating that's the tonification. That means there are the two ways as a tonification. Clockwise direction is the tonification. The second tonification to be known as a, now liver meridian started here, it ascends upward direction. If it is ascending, then that is the tonification. If I wanted to sedate the energy of the liver meridian, when we don't know whether we wanted to tonify or sedate the energy, that time we are in dilemma. That time you just use the same point as a tonification, same point as a sedation. Now the single acupuncture point I tonified and I sedated, that get the neutralizes as well. So therefore, even you can, when we are the confidence about the treatment, whether the patient is required as a tonification, certainly 1 needle you just apply, that's quite enough. Or we wanted to use both the needles in this way, that also advisable, but not all the time it is recommended. Hopefully you understand. Now 1 point, tonification this direction and sedation to be done in this direction. So what exactly the timing to be taken place? So morning, early morning 2 o'clock, that means 1:30 a.m. as a tonification, 2:30 a.m. is a sedation. Right? So in this way, in this concept we can do it, but however it is little difficult in the early morning. Anytime you wanted to use the needle, use the tonification, always is good. When the patient's vigor and vitality is more, that you need to sedate. When there is the deficiency, you feel that by looking, by talking, by conversation, that time you just tonifying. In this way we just manage. Of course, by using this particular point, you remember all the head related disorders, right? All the vision related disorders, GIT related disorders, tendon related disorders, Achilles tendon, peroneus longus tendon, brevis tendon, or any kind of the extensor tendon. The patient do have the arthritis kind of the pain. That particular time the Chinese says wind. The energy form is the wind. Wind is the reason to cause the pain. So therefore anywhere is the wandering of the pain or the shifting of the pain. Sometimes I am okay today, but later it is converted to the somewhere else. But the pain is on the wrist, the other day on the other side. In the same way the patient is suffering from the different places, then you understand it is connected to the wind related problem. Urticaria is there. Sometimes urticaria is here, sometimes is the some other direction. Sometimes the patient feel here urticaria, sometimes is here urticaria. Urticaria, as I told you, the urticaria skin is belongs to the skin, but at the same time the wandering and shifting, because it is the over controlling by the lungs which leads to that problem. Sedate to the liver will be the solution for even urticaria conditions as well. You need not to test to the pulmonary organ, but of course we need to select and treat for the liver problem causing the excessive heat in the liver, flares of the urticaria as well. That's the reason we sedate the liver. That also will be the solution. At the same time, this one particular point, as I told you, good point to treat for the inguinal hernia, umbilical hernia, or anywhere in the hiatus hernia, anywhere in the body there is a lump or hernia is there. That condition certainly it is recommended. Now we'll move on to the liver 2 point, that is the Xingqian. So where that point is located? There are the two locations, but now I am using 1.5 chun needle, but here this maximum needle can reach to that area because more flesh is. Liver 2 sir ನೀವು apply ಮಾಡಿ. So liver 2 point is in this region, half chun. Now just a second, use the other needle. It touches to me, now it is not recommended to use. Yes, half chun, good, above the web margin, that's quite enough. Now this is just as a perpendicular we applied. Whether we wanted to tonify or sedate, it is a question mark. Now it is not question mark to me, but for you, whether I wanted to tonify, I can tonify in this direction. I wanted to sedate, I can sedate to lower direction. Now normally this is liver 2 point is the sedative point, that means is the sun point. It decreases the energy of the liver. So therefore it is a being a sun point, then should be decrease the energy. I just apply slightly to the sedation to be taken place. In this way I just sedated, that means the opposite direction of the energy flow is recommended. So when I wanted to use tonification, even some people believes that the tonification is good point to treat for all kinds of the infection as well. Anywhere infection in the body, perhaps is the eye infection or the abdominal infection, colon infection, joints infection, inflammation anywhere, even that condition certainly you can use tonification is good. When I wanted to use the single point, when the same point to be tonification to be taken place, I just inserted the needle towards the energy flow, towards the chi flow. Now this is anywhere, especially the vision infection, liver infection, abdominal infection and sinus infection. Based on that perspective, keep it in the mind since it is related to that particular subject. Now liver 2 is the sun point, it sedates the energy, but good point to treat for the diabetes, and also when there is no sleep is there, because eyes are burning and also inflammation is there, even redness is there. That condition also really good point to treat the liver 2 is always is good. Right. At the same time, the liver 3 is amazing point for the day-to-day clinical practice we use. Apply here, swipe it once again. Yes, No, I should. Yes, good. Very good. Now you just apply liver 3. Now I'll show you the point. This is one thing is, remember, this if you apply liver 2 here, that also right point. If you apply liver 2 here, that also right point. If you apply both the points, that also good point, because that area to be known as a, here I wanted to say, that area to be known as a web margin to the half chone proximal, that entire area to be known as a liver 2. The liver 3, I touch and feel, this is the dorsum of the foot, and in this foot region now I feel the metatarsal bones. Metatarsal bones, the first and second metatarsal bones, I try to find out. This is the first metatarsal bone, this is the second metatarsal bone. Midway between these two, there is a hollow where the base, this is the base of the metatarsal bones. From here there is tarsal, you just in between there is a hollow depression. In that depression, just distal to the depression, slightly just distal to the depression, and this point to be known as a liver 3. Yes, try to find out. We shouldn't touch to the tendon, we shouldn't touch to the bone. If we touches by mistakenly, certainly the patient feel pain. Good, you find that correct, absolutely right. That goes to the deep one chone. Now there are the two directions you can apply. One direction, this is in fact is perpendicularly she applied, but this is also good. Now this point to be known as a source point, it receives the energy from the gallbladder. At the same time, this is the grand sun point as well. That means it sedates the energy of the liver. Because of it is the source point, again it receives the energy. That is the beauty of this point. Otherwise, above 70 years I don't recommend. Above 65 years old, 90 years, the geriatric patients, and I don't recommend this point because it depletes the energy drastically, because it is the fire energy, this is the fire energy, this is the earth energy. The energy goes to the fire element that bifurcates according to the 5 elements theory. It don't go to the heart meridian, but it goes to the spleen meridian. Heart is required to the energy. When the fire energy is there, the geriatric or old age patient or the palliative care patients, you shouldn't use this point is advisable, because if you use it liver 2 and liver 3, both the points are good, but don't use as a single point. It drastically drops it also to be known as a hypoglycemic point. That means the glucose level the direction. Now this is liver 4. Now I wanted to apply exactly this is liver 4 as a tonification towards the energy flow, right, towards the energy flow. We can use as a tonification, also we can use sedation, also recommended. Now liver 4 is completed, but it is indicating grandmother point. That means it is the tonification point, and also it is strengthening to the liver system. So which point is strengthened? One is the liver 1 is the tonification, liver 4 also tonification to the liver, which is communicating to the Shao Sheng and then Chung Feng. Shao Sheng is the LU11 and then liver 4. Both the conditions, lungs condition, liver condition, if there is the problem is there identified by the etiology, by using the investigation laboratory test, or the patient itself is complaining about I do have the problem related to the lungs, and also my pain is there on this intercostalis region, abdominal pain, or the nausea, vomiting sensation, or indigestion, dyspepsia condition, certainly we can use the liver 4 as well. Now liver 5 points are luvo connecting point. Liver 4 is liver 5 is luvo connecting point. So how to apply this? I just apply, because this is 3 chone, again 4 chone, and then 5 chone. Now the point is located, this point at the border of the tibial crest, that is the spleen meridian, right? At the spleen meridian, 1 finger breadth anterior to that, this point to be known as a liver 5. So now if I apply this is it touches to the bone, you got, it touches to the bone, that indicating more than that it will not enter the needle. So that's the reason I just applied towards the chi flow. Right, now if one point, if you wanted to use the 2 points for the one needle, also advisable. Now this point is the luvo connecting point. It scatters the energy communicating to the liver and then gallbladder as well. The energy moves in this direction and communicating to the gallbladder as well. Then this energy goes to the upward direction, and then on the pelvic region it encircles to the scrotum and penile organ and then female genital organ. Certainly it covers the entire region of the pelvic region. If anything, the testicle related problem or the penile related impotency related disorders or the erection related problem or the female frigidity related disorders, certainly we can use this point is good. Now is liver 5 point. The liver 6 point is the chungdu, that is 2 chun proximal to this point. 2 chun proximal. Even we can select in this direction also from how many chuns from here to here. From here to here is 13 chun. From the medial, from here to here is 13 chun. Like this also we can measure, but however fingers measurement for the initial stages is good. Now we'll move to the another point to be known as a 2 chun proximal, right? So anyone can apply here to the upward direction. So 2 chun from here, 3 fingers above in the same direction on the bone. This is the tibial crest, and then 1 finger breadth anterior to this. This is the crest. Here is spleen meridian. From here is 1 finger breadth superior to this. From here you just apply upward direction, right? This is in the horizontal direction. That means in the 15 degrees Celsius we insert the needle that goes to the deeper level, right? If it goes little, that also quite enough. Now this point to be known as a liver 6. Liver 6 is the chungdu. What indications I told you? Related to the numbness. Numbness on the foot region or the sole of the foot region, or particularly this region. The people say, sir, mara kattadang haagbutide, sornene nanaka eno kaansta illa, gottagta illa, sensation is not there. That time you touch and feel. Are you feeling any sensation? You just ask him, yes, I have the sensation. Then you just go in this direction. You ask him, do you have the sensation? Yes, I do have. You feel that, you can say here, if he says yes or no. So even he says that I do have the numbness, then you just apply. If you don't feel the numbness but internally he feels that, and also sole of the foot, generally apply. Hands, feet, and hands also feel the numbness, and forearm and all. Even that condition also it is recommended bilaterally. This is a chungdu. This is the another beautiful information is there when I'll take the extraordinary points. So this point is in fact is the anesthetic point. Anesthesia to be done even for the normal delivery purpose or the cesarean section. Normally the gynecologists do the cesarean. That cesarean also to be regulated without doing the anesthesia by activating to the nema and then vema. This is the nema, another point to be known as a vema. Knee means in the medial side, ve means is the outer side. But there are the 2 points strongly we do the vibration, and after some period of time the pelvic region will get the numbness. But this both the points also good point to treat for the anesthetic purpose as well. Now the liver 7 is the really very imperative point which I told you. There is a point for treatment for the thrombosis of the legs. So where try to find out where exactly this point is located. Now it slightly get changes. You press and feel, this touch and feel. Come